The Center for Health Design had something called the Pebbles Project. The Pebbles Project is the idea that we can make decisions around the built form based on evidence and then report on the outcomes that we achieved from that design intervention after the fact and contribute those findings to the broader design community so that future projects can build and start from where we left off. Well, since that time, 3.5 years ago, the Patient Care Center project has been a designated Pebbles partner, and I'm pleased to say we're the first international Pebbles partner.
Just to reiterate, Your Worship, why we are here tonight, to seek a rezoning amendment to the Royal Jubilee Hospital site, to seek approval and support from City Council. Such approval would enable us to award a contract with all the necessary planning approvals in place to allow our new Patient Care Centre on the Royal Jubilee site to be built as soon as possible, and so help us reduce construction inflation as we move forward with our project.
You have a very exciting new building that will very rapidly become a finished building and be the state-of-the-art facility, not only on Vancouver Island, but to my knowledge in all of British Columbia or Western Canada. It will be truly an outstanding facility, not only by the standards of British Columbia or Canada, but really in major ways by international standards.
Isn't it exciting to be in an almost completely finished unit?
Mm-hmm. It's looking just like we planned it to look.
Yeah, and it looks a lot like the mock-up, which is, of course, the right answer. But what's really exciting to me is how quiet and calm it is compared to the construction site, but also compared to our existing hospital units.
Yeah. So now we're entering the area, which is really what we're calling the pods, and these are the bedroom areas. This is where the physical hands-on care of patients will happen, which is that separation between administrative and care functions.
And because of that, the conversations about patients, about finding staff, about finding things, and all those other conversations that take place right now at a care team station are taking place on the other side of those double doors. Down here, it's just patients and caregivers and their families, of course.
Yeah, and you can see we have nice, clear hallways with handrails on both sides, so this provides a perfect place for our patients to get up out of bed and ambulate around.
Early on in the process, we felt that it was important to set out a clear vision of what we wanted to achieve with this facility, and I've got a few slides on this. As you can see there, we have this vision, and this vision and the core principles behind it guide every decision we make at the project team and within VIHA and in our planning and will guide the design and construction of the facility. In particular, the core principles, we believe these are key aspects of the hospital and its contribution to the health of patients, to the health of staff, and of course the health of the environment. And so the way those core principles have manifested themselves with respect to patients, the people that we are in our trust, is a recognition that the vast majority of the people looking forward for the next 50 years who will be overnight in our hospital will be older adults, the elderly. And so we have an opportunity here, and we are planning on building, as far as we know, the first elder-friendly hospital in North America, a hospital that's designed around, from reception through to discharge and during the stay, around the requirements of elderly patients.